in conjunction with This Can Happen, which supports men's mental health in the workplace. So enough talk from me. I'm going to hand over, if we go to Dr. Jeff first to give introductions, and then we'll go round and start the discussion.
Hi, thanks for having me, it's very kind. Yeah, my name's Jeff Foster. I'm a GP with a specialist interest in men's health. I've been qualified for about 18 years now. Obviously don't look like I've been qualified for 18 years. I've done men's health about 7 or 8, it's coming to 9 years now. I now sit on the national board of the British Society of Sexual Medicine, writing the guidance for men's health. So that encompasses all aspects from testosterone deficiency to mental health problems to erectile dysfunction to cardiovascular, all the stuff that basically we should do better in terms of trying to handle men's health overall. And I now run a national company called H3 Health, which is specifically designed to look at the health problems that men and women specifically face that aren't particularly well done in the NHS. So classic examples would be testosterone deficiency, menopause or male menopause, mental health problems for men, etc., etc. And yeah, we're trying to see if we can change attitudes towards how guys think about things.
Thank you, Jeff. Thank you for being here with us. Catherine, could you tell us a little bit about yourself?
Yeah, absolutely. So I am Internal Communications, Diversity and Inclusion Manager for Mercedes-Benz in the UK. I've been with Mercedes-Benz now for about 8 years. And in amongst that very long job title, it means that I'm responsible for the UK wellbeing strategy for Mercedes-Benz. And what that means is we focus very much on 4 pillars of wellbeing. So that's physical and nutritional, financial, social and digital. And the one that we're going to lean into today, the mental and emotional side of what we do here at MB.
Amazing. Last but not least, Linda.
Thanks, Jack. So my name is Linda Gillam and I'm the Clinical Director of Healthy Minds here at Peppy. My background is I'm a BACP Senior Accredited Counsellor and I've worked at Peppy for just over 2 years now. And at Peppy, we work in men's health via a chat system where we support and signpost our users as much as we can, both in-house and to external services.
Super, thank you. Right, so let's get into it. We'd love today to be a two-way conversation, to be as interactive as possible. So please put questions and comments in the chat box. We'll have some time at the end in the next 45 minutes or so to address questions from the audience. So please keep them flowing through to us. The first thing we want to do, though, is set the scene as talking about mental health specifically from a men's perspective. One of the things we talk a lot about in Peppy is providing a personalized approach to healthcare and to supporting men in particular, because there are certain stigmas or differences in the way that men interact with healthcare, particularly mental health. So what I wanted to do first, and you can see eagle-eyed viewers will notice that Dr. Jeff is in situ in his own practice. We're not going to have any appointments today, I promise, or hopefully not anyway. But Jeff, I want to speak to you first of all and basically get an idea from you. What are you seeing as a GP in the men's health area? What are you seeing day to day in seeing patients and speaking to people?
I think attitudes have changed in the last few years, and we are seeing increased numbers of men coming to talk about mental health problems. But we're generally seeing 2 extremes of mental health problems. So we're seeing much larger groups of younger men who are attending doctors with what I would sometimes deem less severe mental health illnesses, such as breaking up with girlfriends, stresses at university, can't afford to go out on Friday, right up to the other extreme of men that are really close to suicide or psychosis or delusional beliefs, hallucinations, etc., things that would really put you at the far end of mental health. And these guys are the ones that you're often catching a bit too late. The problem that I think we're finding is that the ones that we really want to catch, mainly the guys in their 30s, 40s and 50s, are still not the ones that we're commonly seeing. And these are the guys that are bubbling under the surface, who may never come and see their doctor, but the next thing you find that some terrible disaster has happened. And all that time, I think if we could have got to them a bit earlier, we might have been able to intervene and do something different. And I think that's the challenge of where we need to go.
Thanks, Jeff. I think we've discussed this before, and there are some great celebrity role models out there for men, to encourage them to talk about mental health. But sometimes I think there are different ambassadors for different generations, right? And I certainly feel, as a male myself, I feel there's such a vast differences in approach depending on class, geography, nationality, different cultures, areas of the country, industries, and even something simple as age, as well. It'd be really good to address that shortly in a minute, but I just want to put a question as well to Linda around what barriers have you seen to, kind of complement what Jeff has said, but why do men basically struggle to engage proactively with their health?
That's a really interesting question, because I think on the surface level, often there's many reasons given about time or availability of appointments, or the fact that they haven't done it for a long time. What is enough to prompt them to make a GP appointment? But I think under the surface, there's more of that psychological level of feeling that maybe it is viewed as weak to go and ask for help. So I think there's the emotional part of it, where there is a fear. There's also a fear of what they may be told. They may think there might be something going on, but to actually go and be told that, yes, that this is a thing, it's scary. Particularly, I think, if they haven't engaged particularly with GPs or a therapist in particular before, they may have an idea around what it's like to be in therapy and make the decision without even approaching anyone that's not for me.
Thank you, and we're really fortunate to be joined by Catherine today, as as essentially someone within an organisation trying to do something for your own employees. What have you done at Mercedes-Benz around mental health from a workplace perspective? And it'd be interesting to hear as well. I presume you have a diverse range of employees doing lots of different jobs, specifically male, let alone across the whole population, right? So it'd be great to hear about that too.
Yeah, absolutely. Absolutely. So it's been about 3 years now, I think, since we launched our wellbeing strategy to the business. And we set out that we were going to break down barriers. That was the main thing that we said we needed to do. And in particular for us, it was about destigmatizing men's health in the workplace. Across all the comms content we've done previously, that was a bit of a gap for us that we needed to address. So a lot of that for us was around normalizing some of the topics, normalizing the language associated with mental health was a big piece for us. And more so even just building a foundation of trust, building up the knowledge within our business. We've got people, like you say, working in different businesses across the UK, different workplace environments, and we just needed to create a strong foundation of trust and knowledge across all of those. Obviously, being automotive, there's a strong expectation that we're going to be a male-dominated, a very masculine environment, and actually for us that's not the case. That's not the reality of who we are as a business. But that kind of historic view brings with it a lot of stereotypes, and what we've needed to do really is to work to break those stereotypes of what it means to work in a male-dominated environment and what this picture of masculinity within that environment is. So it's been really, really key to us. And I think within that, we've done a lot around the knowledge, the trust, and building that up. So for us, launching things like Peppy has been a natural next step as we've evolved that strategy for our colleagues, providing mechanisms and this kind of flexible self-service option for our colleagues. It hasn't been a standing start. It's three years now that we've been doing this, and we've got other complementary mechanisms like virtual GP, we've got a mindfulness program, we've got mental health specific training for our line managers, but it's just about finding that variety of solutions that matches the diverse workforce that we've got. And kind of, I think for us, we've got this mantra that bring your whole self to work, and the idea is you bring your whole self to work, not your best self. It's whatever it means to bring your whole self into the workplace. And actually what we've needed to do is find a variety of these kind of flexible solutions to make sure that we make the most, particularly with men's health, we found, make the most of these moments of confidence that men find to come forward and have a conversation. So it's that kind of right support at the right time. That's been the key to what we've been doing.
Yeah, I love that, and I guess from in your role, particularly around communications as well, you've got to get the right tone, the right timing, the right frequency, the right method. Can't just machine gun emails everyone. Presumably, some of your staff might not have work emails. They might be in, different roles too, right? So it's not an easy task to start with. So I bet you've learned a lot over the past 3 years as you've grown as an organisation as well. Jeff, I just want to come back to you. There's an obvious connection between physical health and mental health. How much of a role does that play in men's health as well, in particular?
There's an assumption, I think, for guys that as you get older, you aren't supposed to be as energy filled and happy and content as perhaps you were. And the phrase we often use through our company, H3, is the idea that you're confused as just normal for age. So you might say a 45-year-old guy shouldn't want to have sex as much as he did when he was 20, and he might struggle at the gym as much as he used to, and he might feel a bit more grumpy, and his wife might not get on with him so much because they've been married for years and they've got little kids, and it all gets in the way, and these all start to impact on your mental and your physical health. And you can often get misdiagnosed as being just middle-aged or being depressed or being anxious. And I think we always try and make a really clear starting point when we're looking at saying, do you have a mental health problem, in saying, is there actually underlying physical issue behind this that we haven't addressed? Probably the best example you could use is testosterone deficiency, which I harp on about all the time, but it's really important. And low testosterone in men, just like low estrogen in women and menopause, causes you to feel depressed and grumpy and lack your energy, and you don't want to do things anymore. And that's this idea of normal, and of course it's not normal. So I'd always say, if you think that you're struggling and you haven't had some horrible life event and there's no particular reason for you to feel rubbish, don't just accept the idea that somehow because you're in your 40s that life should be crappier. And I would say go find a men's health specialist and speak to him about this and get your levels and other things checked. It doesn't always have to be testosterone. And there are lots of other things, thyroid disease and anemias and vitamin Ds and lots of things, and even just lifestyle stuff makes an enormous difference. But unless you sort of sit back objectively and have someone maybe that doesn't know you look through these factors, and you really do want somebody who's mental health specialty trained, and I work as a GP, but a lot of us are not specifically trained in men's health. You need that specialist advice to go, what should I be trying to do? What do I do next, and where do I go with this? So I think the crossover is massive. I'd say never assume it's mental health if there could be a physical cause, and for God's sake, just get the blood test done. It's so easy.
I mean, that's a general theme amongst men's health, isn't it? Is the kind of lack of, attention, or lack of desire to come forward. Sorry, get the words out. And I think you hit the nail on the head for me in terms of, don't just accept that something is going on and just take that as gospel, that's it. It's possible to find a cause for that and to treat that cause, or it's possible to even treat the symptoms of it and kind of improve the state of life at that time, especially in that example potentially with low testosterone and the impact of it. I want to, Linda, I know you speak to lots of male users day to day, especially from a healthy mind perspective. There's lots going on in the world right now. There's so many pressures and negative instances that are happening. How are you seeing this is impacting men, and the men that are basically seeking help or support that you're talking to?
I would say our engagement thing is what we call mental fitness. So a lot of the men are keen to talk about maybe their stresses. We have people that want to talk about things like imposter syndrome, procrastination. They may be working at home and they feel that they're not getting stuff done. But I think one of the things that comes across the most is that often they're surprised that other people might feel like this, because they don't tend to talk about it too much. It's not a conversation when they're out with their mates. They don't say, did you have some negative thoughts today? That doesn't happen. So it's really good that on the chat, it's a private, confidential, on your phone, in your hand, where you can just drop us a question. You can say, I've been feeling like this, what can I do? That kind of thing. So it's that immediately accessible. When you have that thought or that feeling, you can type that out and someone will say, okay, maybe tell me a bit more about this. So they don't have to make an appointment. They don't have to wait a week, and then change their minds maybe in that week, because they may feel a bit differently in a week's time. But when something's happened at work and they're feeling very stressed, they can pop a message in the chat. And I feel that's why our engagement is so good.
Thank you. When I think about my own personal circumstances, as a male, and what I would want to talk about and what is causing me stress, and there's so many different things going on right now. Like I said, cost of living pressures, and men are generally speaking, statistically, much poorer than women at coming forward to talk about these things. But it's great to hear from Jeff, for instance, that there's potentially a bit of a generational shift, that younger people are coming forward and talking a little bit more, but maybe they're talking about everything instead of specific things, but it's still probably a step forward in the right direction. When I think about that type of shift, I think about things like engagement and changing the conversation to make people aware of everything that's going on and the support they have available to them. And that's where I go back to Catherine, in your role, Catherine, again, communications is so important. Has it always boiled down to messaging, or have you found sometimes it's not always been a top-down approach, but there are people who have come up and actually taken charge of this messaging and helped colleagues with it, almost like from a champion perspective?
Yeah, that champion viewpoint has been so important for us. Generally, on all our culture topics, we don't really go for that top-down approach. It's very much colleague-led. That's not ignoring the importance of leadership buy-in. That is important. You do need that within the business. But actually, this idea of this swell of engagement that comes from your colleagues, it makes it feel so much more authentic, and actually it makes it more sustainable for your business then, because you've got an entire community of champions, or as we call them, passionate advocates, who are helping to support your messaging. And that really links back to what I was saying about trust earlier on, because that's been the foundation of all of this. Without that trust, we wouldn't have been able to achieve what we have. And the key to that trust, beyond the comms messaging that we push out, has really been around colleague storytelling and being able to do kind of case study examples with our colleagues. And to do that, we've had to empower our colleagues. That's why I'm talking to you guys, they're 3 years in, is that we've had to really empower them to come forward and say, hey, you know what, this is a safe space for you to do that and to open up that conversation. One of the things that helped us to do that, because you can't just go out to somebody and say, hey, come and have a conversation about something that's really personal to you. One of the ways we've found really helpful is the kind of the national wellbeing days, awareness months, that kind of thing. We've been using those as kind of the hook to hang this storytelling on. So as a comms team, we're here to do the awareness and kind of set the tone, but then it's over to our colleagues for them to do the storytelling piece from then on. So I think a nice example for us would be International Men's Day, which we celebrate as a business every year. And last year we did an article through our digital magazine called Man Up. And this was contributed to by our colleagues who came forward, and it was all about breaking down those stigmas, those barriers, those stereotypes that I talked about earlier, and really explaining that there is no one way to be a man. And we made that story a very open forum, a very open dialogue for our colleagues, and it was incredible. They shared so much insight about their lives and some of the struggles that they faced, and it just really helps. It's that normalizing the conversation and just starting to create a dialogue within a business. So those passionate advocates are absolutely key to what we do. I think without that, we would have been really stuck in this kind of awareness knowledge phase, and we wouldn't have been able to evolve into a place where people have got the confidence to use apps such as Peppy to start having a conversation in depth about their own concerns.
Yeah, thank you. I almost switched off for a bit then. I was listening to you so intently, I forgot that I was meant to be hosting a webinar. What you said was really interesting. So Jeff, Catherine as an employer, what she's just explained about, talking to her people and supporting her people, what sort of signs could Catherine look out for you know, in terms of symptoms or triggers that she could help identify to then, you know, support her people more?
I think the classic mistake we tend to think in terms of mental health is the stereotypical image of people being depressed, which is actually, by the time you're hitting that, certainly as a guy, you're already fully diagnosed as depressed and probably hitting further along. Most blokes are very good at hiding a lot of their symptoms, as we kind of already alluded to through what we've said. So the softer signs we tend to look for are things like not engaging. So, you know, coming into work or doing your job particularly well, not engaging with colleagues, pulling back from social events, and certainly things where you may feel, I don't know how it works in Mercedes, but certainly we would have a coffee every day. We're here at 10ish, and everyone, whether they likes it or not, has to go upstairs, and we vent and shout about how we get frustrated with patients for 20 minutes. But that's really important, and it makes everyone feel a bit more cathartic about it. And I think when those early signs are those things where I don't want to engage, and you're maybe not actively but subconsciously starting to pull away. You might also find, and again, not necessarily directly related to work, but things like activities, things you used to do that are enjoyable, you start to pull away from. So exercise, you start to pull away from. Your diet starts to go to pot because you kind of think, what's the point? Why do I bother? People look tired, their sleep gets disturbed. And so you may not see a colleague who has one single thing, but you may seem or just notice that they're not quite as on it as they were. And that's really the best sign we tend to look for, this kind of person who was really good and suddenly just seems to have lost a little bit. And that's the soft sign that they may be hiding stuff underneath. And that's probably the best time to get one of you guys involved and say, what else can we do?
Thank you, that's great. And actually, I want to kind of pounce on that soft side that they're hiding underneath comment, because I think that's so true with so many men, that they just kind of hide it away and they don't necessarily want to address it. And there's so many different barriers. So I think somebody mentioned earlier about booking an appointment and then having to attend the appointment and then, you know, doing a follow-up. It's such a drag for a lot of men that they just think they can't be bothered. And Linda, I want to ask you, you know, for men that might be fearful of coming forward and talking about their mental health, how do you start a conversation? How do you kind of reach out, be that a person getting help or somebody giving them help in the workplace or not?
It can be tricky because I really think that for most of us, whether or not we're going to engage with another human being happens almost immediately. We make that kind of judgment as to whether, oh, could I talk to this person, or actually, you know, so that initial engagement is really, really important. And I think the worst question we can ask is, how are you feeling? That's an absolute switch off. So it's about building a conversation, maybe about something else entirely, because as Jeff said, the behavior is going to show you how that person is feeling. So all the signs are there in a conversation about something else. If you say, how you doing today, or how you feeling, there's an incredibly high chance you're going to get fine, which is going to tell you absolutely nothing. So it's about working with somebody and assessing as you're working with them by chat or in person, you know, on the phone, and assessing those and thinking, okay, is this that? Is this, you know, are they feeling a bit flat? Are their responses a bit flat? And that's where you gather your information rather than with the direct.
It's kind of that sort of holistic approach, isn't it, to breaking down the barriers, right? It'd be really good to understand actually from both Catherine and Jeff how you use language in your positions differently to talk to people about these types of issues. Because I know, Catherine, you're kind of, in your role is a really specific role, but you're still kind of representing the employer, aren't you? And Jeff, you're as a medical expert that people are coming to talk to. So yeah, how do you use language in your roles differently? Catherine first.
I think for us, it's creating a really accessible approach to language. We always have coined a bit of a phrase within our team that says we should be one step away from pub speak when we're talking about this. So, you know, if you stood in the coffee shop queue and someone says, oh, I'm not feeling great today, how would you speak to them? You know, it should be that accessible. I think it's easy as an employer to fall into the trap of thinking you have to sound like some kind of expert. that you have to almost be the parent to, you know, the children that work within your organisation, and that for us just doesn't work. It's got to be, you know, very much grown up to grown up, very accessible, very normalised in the way that we approach it.
Thanks, Jeff. What about you?
Kind of similar in a sense. So we had a lot of training during medical GP stuff about how you need to change the way you approach consultations nowadays, and I think the old maternal aspect of how you were a doctor years ago is hopefully starting to phase out. I mean, one of the things that you never do when a patient, certainly as a guy, when they walk in, the thing you never ask is, how are you today? Because it's a pointless question. Because if they're depressed, they're not going to go, God, I'm going to kill myself, because guys don't do that. So they're always going to say, I'm fine. So you almost feel like saying, well, we'll just get that bit out of the way. And you just come in and you say, well, how can we help? And often you find that you don't want to be seen as, even it's weirder, because I guess for me, and not in an arrogant way, but people are coming to us because we're the experts in that area, per se. So you expect a slightly different discussion. But on the other hand, if you suddenly take this moral high road of, well, I've done this training, so you better listen to me, you're not going to get anywhere. And part of the learning thing, I think certainly we've approached from the men's health side, is to say actually that mental health is very, very different to something like chest infection, where, you know, X equals Y. You give an antibiotic, that'll treat that infection, that gets better, that's fine. With mental health, you keep learning stuff as the doctor, probably from your patients month after month. And I was thinking about the other day, so I've done about 10 years worth of GP and men's health stuff, which equates to about 45,000 consultations over that time. And you realize over that time that there are certain ways that men will always present, and this kind of pattern thing. And you realize that certain ways I consulted maybe 10 years ago, or maybe 15 years ago, when I was a bit more junior, was very much like, oh, I'm the doctor, and I'm going to tell you this is what the problem is. And you realize that gets you really far, very badly, doesn't do anything. You end up with complete failed consultations, and people don't want to listen to you. So to learn a bit of humility and to understand that your patient's journey is entirely unique, and they may not spit everything to you the first time they see you, is crucial. And I think it's how you learn to not cock up as you get more senior.
Yeah, no, thanks, Jeff.
Not cocking up is quite important in my job, generally, I think, as in all of us.
Yeah.
Certainly, as a doctor, you don't really want to be cocking up. So
absolutely,
understanding that yeah, you still need to have a lot to learn, even after 20 years, is quite important.
Jeff, do you have to kind of change your approach depending on the patient that's in front of you? Do you change your communication or the way you're talking to them? And, you know, I know you said the how are you thing, it's almost pointless. How can you help is different. But do you adjust your approach depending on the you know, I don't want to put boxes out there, but ages and different things like that?
I think to a degree. I mean, there's the natural extremes of age. Still treat elderly patients with a different degree of respect than you would maybe somebody your own age, and you treat children very differently, obviously the same. I think what I tried to do more so now is not to make an assumption. So you never know if the guy who walks in with a suit and tie is just as anxious or panicked as the guy who's the builder and walks in with his shorts and torn t-shirt. So I don't do the really, I don't know, it's a terrible version of just going, all right, mate, come in, have a seat, do you want a drink? Because that's probably going too far. But I think the whole point is that you can simply just make language a little bit lighter, so that you feel they can engage a bit with you, and that maybe the first couple of minutes of your chat is not something that's just about tell me your top 5 symptoms, and it's more just about tell me what's going on and how's your life, and you can find out a bit about each other.
Yeah, thank you. I think there's certainly a trap that people fall into when communication becomes written, for instance, that people write something different than how they would talk. And, you know, Jeff, you're saying you remain pretty consistent, but you might just approach the patient in a slightly different way depending on who they are. Whereas in written communications, we tend to become a lot more formal. And Catherine, you were mentioning about, you know, not too far off from a pub conversation, why would we talk to people like that face to face, and even have a doctor like Jeff, or a clinician like Linda talking to somebody openly face to face, but when in writing it becomes this unnatural kind of thing. I think that's something that's actually changed a lot over the decades. Written communications become a lot more informal kind of thing. But as a man, myself, I want to be just spoken to in a transparent way more than anything. I want it to be really simple and signposted me to where I can get help. But there is an element for me of you can take a horse to water sort of thing. And I think that's a big problem with men, that you can wave all the messages you want in front of them, but sometimes you can't get them to take that step. Or if it's a physical piece that could be impacting their mental health, they might wait until it's far too long to get help on a physical thing, and it's dramatically impacted their mental side of things too. So what I want to do, Catherine, is just ask you to open up. We've got a lot of people listening and watching who may be in similar positions to you or working internally within companies. What advice would you give them in introducing initiatives to the workplace, or what's the first steps that they can take? Any advice? What's gone wrong, or what's surprised you and has been a real positive?
Yeah, I'll try and stay clear of giving any advice. Obviously, every business is different and every colleague is different, but I can share a little bit more. Yeah, advice with a little A I can do. And I don't want to keep harping on about it, but it is those two things that I've kind of mentioned throughout. It's setting the tone and this storytelling piece. For us, I just cannot stress enough how much that's really helped us to get to where we are. And when I say about setting the tone, I've touched on it, this foundation of trust is absolutely key. But also taking the time when you're setting the tone to think about, where do you want well-being to sit within your business? It's so easy to plug it into HR, and so that's where it sits. Is that right for your business? Is that right for your colleagues? How do they engage with HR? Is this going to feel accessible for them? Is this going to feel transparent for them? And just take the time to understand that. And again, back to that top down versus bottom up approach. Again, think about your organization and what works for you. For us, this colleague led approach is absolutely the right thing, because it's authentic to us. It makes it, it's credible to us, because it's how we approach all aspects of culture within our business. If that's not how your business works, and it's very much led by a single person in charge who sets the tone for your business, then going colleague led is probably not going to feel very authentic for the people you've got working with you. So just really take the time. I know it can feel like you want to rush into it because it's such a worthwhile thing to do, but actually to take a step back and take the time to get it right, that's what your colleagues deserve. So it's worth doing properly. And then on to that storytelling piece, which I know I keep talking about, but again, it's just so important. For me, understanding lived experience is the key to a shared experience for our colleagues. That's really at the heart of what we're trying to achieve here. So take the time to share colleague stories. Those who are on the call who are in a position of being in comms or marketing for their business, take the time to share those stories. Do it in a way that informs and engages your colleagues and inspires them to start a fresh conversation within your business. And that takes, as a comms person, that takes a lot for us to be curious. We have to be curious and go out there. People don't just put their hand up and come forward. You've got to actively put yourself out in the business, and that sometimes means leading by example and being vulnerable yourself. And within that, you've got to be brave too. You've got to be brave and put yourself out there. But that will absolutely pay dividends, because in doing that, you will find the untold stories, and that's the ones that people really relate to. And that's then when you start to see this conversation slowly opening up as the trust builds, and you start to see a genuine dialogue happening, and you start to see line managers being braver in the way that they ask. They're not just, back to your point, Jeff, they're not just going to say, how are you today, when you start a one-to-one. Actually, they're saying, I'm starting to notice that you didn't come to the pub on Friday with us, or I've noticed you haven't been at the last couple of colleague events. What's going on there? Is there anything that you can share with me today? So it all comes out of that storytelling. It's that, you know, it's a conversation after all. So it's our job as a comms team really to start the conversation.
Super, thank you. I think today's topic has obviously been engaging men in their mental health. We know we're talking about that specifically because men are not as good as women at doing that. I mean, physical health as well, right? Not as good as like coming to the GP stand, you know, full stop, let alone engaging in different areas. But here's a loaded question for you, Linda. Should we keep men and women's health separate?
Should we? Should we keep it separate? I think it really does depend, because although we're talking about engaging men, a lot of men are engaging as well now. And I completely agree with Jeff about the age ranges. We're seeing a lot more men engage under around 35. You know, when the people join our chats later, it's harder to engage, or maybe they've come for one thing and then they go away again. It's not a continuous conversation. So I do think there are a lot of differences between men's and women's health. That said, in probably pre-pandemic, when I still saw people face to face, my client base was male. So that was quite a big shift. I've been, you know, counselling now for nearly 15 years, and that suddenly seemed to be quite a big shift, that many more men were coming forward and asking for therapy, etc. So whether we're going to see more change and whether they're going to become more similar in men's and women's what they need, you know, who knows? But I do think that the tide is turning somewhat, certainly with the younger generation, where this is becoming much more okay to say, actually, I'm not okay.
Yeah, thank you. My background has been in consulting in the HR and benefit world, and I've always been keen on employers understanding their demographics, but not putting people in boxes and trying to address them in that way, because you might hit the message right for a percentage of that box, but you're not going to, you know, talk to everybody. So for me, it needs to be much more personalized. And I've learned a lot about that since joining Peppy, because I think the gender specific health approach it sounds so obvious, but you know, a woman going through the menopause at age 50 needs different support and advice on her healthy minds, on her diet, nutrition, exercise, than a male potentially 20 years younger thinking he might have low testosterone. And when you say it like that, it's like, well, of course they do, but actually not everyone is taking that approach. You know, mental health sometimes can be one topic, and actually, you know, it's a lot more effective if you break it down into different categories or address it from a gender specific area, even if it's just in communications, as you know, Catherine has spoken about. Jeff, I wanted to ask you a question. Do you have any practical tips for listeners, for themselves, about how, you know, they can manage their own mental health, or identify potentially areas where it's worth coming forward and seeing somebody for support, or ways they can manage, you know, symptoms or treatment themselves?
Yeah, sure. I would just going to go back to your previous point. I don't really agree. I think men and women's health, although there are indeed, as you have rightly said, certain specific things that are clearly different, are not as different as we might think. And I think the menopause testosterone story is a really good example, because we see a lot of people at our clinic who maybe are menopausal, and we give the woman HRT and she suddenly does really well and feels like she's got her life back, and her sex drive goes up and her mental health improves and her body changes and she feels like she used to be and feels great. Whereas the guy, of course, hasn't had anything done, and he may have low testosterone because they tend to happen roughly at the same age. And of course, if you're on the same journey and you both feel crap, it's not quite as bad. If one of you's on this journey where you suddenly feel great again, and the other one's left behind because he hasn't addressed his issues or whatever else, then actually it can create the relationship problem. It can make relationship problems even worse. So I've always been a big advocate that whilst you need to treat them differently, the concept of what you're doing is actually quite similar, because if you have both partners going through the process together, it makes the life for both of them a lot easier, and they can sort of understand each other's problems and their medications and their lives and how they change much more easily. So it's not to deliberately argumentative, but I think sometimes we do assume there are these big differences, but actually when you get to the bottom of it, hormones are not so different, and a lot of guys just need that same kind of support that a woman might have during menopause, but are just too afraid to ask.
No, Jeff, brilliant. Thank you. That's a really fantastic point. Thanks.
And I just add on as well, even if you think about a concept like depression, everyone's experience of depression is different. So you've got to take it right down to that unique individual level. We can't just say I'm depressed, because what does that mean? It means what it means to that person. So we've really got to go in as personalised as we can be, and like you said, Catherine, remain curious. All the time. We've got to not make those assumptions. Oh, I know what depression is. This might work. We've got to really treat everyone individually.
I concur. Going back to your other point then about what you can actually do, probably one of the biggest things we get, well, in fact, the biggest thing we ask guys to do is talk to someone. So there's lots of stuff that we can do outside of that, and easy things I would always say to do if you're feeling that you might not be as positive as you used to be, is to challenge your own negative thoughts about stuff and force yourself to do things that you may not want to do. So we go to get patients to try and do some form of physical activity, walking, exercise, something. We try to make sure they don't drink too much alcohol, try to make sure they do some form of social interaction a couple of times a week, even if it makes them feel uncomfortable and they don't really want to do it, but it's trying not to lose that connection. Once you can do that, it often helps form a sort of positive trigger to get people so they don't have to end up getting worse. I don't even necessarily think that if you're feeling depressed, you need to see me or a doctor. I don't know how far Linda would say you need to speak to her or not, but I think my initial point is that you just need to speak to somebody, and they don't have to be medically trained, but to just have that ability to speak to someone that's close to you and say, actually, maybe things just aren't great, and just get a coffee somewhere or go for a pint or just for a walk or something. And you don't even have to talk about things that are troubling you, but just to have that catharsis of time away, self-reflecting, not talking about things that are worrying you in front of your family or people you feel you can't vent to is so important. And often that's just that first trigger to making the change that means you don't end up sitting in the chair just over there.
I could not agree more with that, Jeff. I think, from my own personal experiences, when I've been through negative things in life, some of the most comforting things for me has been talking to people who have been through the same thing, friends and family that have been through the same thing, not for some sort of treatment, but to just have that discussion, an open discussion. And also, similarly, sometimes not talking about it, but having somebody understand something's going on, and let's just try and be normal in inverted commas and have some company can also be really powerful as well.
Yeah.
So, Catherine, I wanted to ask you, conscious of time, but a couple more questions.
Yeah, of course.
As an organisation, as an employer, again, why have you looked at health as a important element to address? Why have you looked at mental health as a key part you want to help your employees with?
This links back to what I said about whole self, bringing your whole self to work. That really is something that as a business we stand by and we live by. I mean, there is all sorts of research. If you go on Google or any other search engine and type in the links between engagement and productivity, there's loads there. But actually, it's also just the right thing to do to create an inclusive environment where everyone can genuinely bring their whole selves to work. With the changing landscape that we've seen over the past few years, and hybrid working and new normal being these everyday parts of our language now, there is an absolute responsibility for us as employers to make sure that we're supporting the blurred lines that have come out of hybrid working. You've got people working, we call it flexibly and agilely, but actually what that means is that they're working from home and their work-life balance has been blurred like never before. So it's the right thing to start talking about well-being, and really helping people to help and support people as they're navigating all of this stuff that employers are now asking of them under the guise of hybrid working.
I think in that too, there's also a lot around expectation, because maybe some employees wanted to work from home and they've always wanted to work from home, and now they are working from home. It's not quite as great as they thought it might be. Or there may be people that want to still be working at home and they've been told to go back into the office, you know, so there is still quite a lot of difference in this hybrid system now. And I think expectations versus reality comes into that conversation too.
Yeah. Super. I wanted to open the floor for questions for the last like 10 minutes or so. I see there's quite a few that have come through already, and some of them are brilliant. So I want to put that to all three of you as a panel, and then we'll wrap up if that's okay. So one of the questions that come through, and please anybody chip in, all of you, etc., pass it on. Do you have any thoughts on how to approach mental health differently depending on LGBTQ plus groups, trans or cis men, for instance, or from other ethnic groups as well?
Yeah, I'm happy to
Who wants to
jump
go
in
first?
on this. I'm happy to jump in. Cast your mind back to my vastly complex job title. It's not a coincidence that diversity and inclusion is in there alongside all the stuff I do around wellbeing. The two very much go hand in hand for us. We call it sustainable inclusion. That's the approach, and under that sits D&I and wellbeing for us, because they're not mutually exclusive. And it's really important as an employer that we recognise that and recognise the differing needs of a diverse colleague base, and making sure that, you know, there is no one size fits all. I know it sounds a bit trite, but there really isn't. So it's this pick and mix solution, this flexible self-serve, you know, mix of face-to-face and digital opportunities to make sure that you are truly able to reach everybody within your organisation.
Thank you.
I think gender-specific approach applies more to how people tend to present, not how you might treat them. So it has to be gender-specific in terms of you're looking at a significant majority of patients that will present in a particular way. But of course, you would address how you treat or manage those on a completely individual basis. It doesn't matter what your gender or type of diversity or any other aspect would be. So it's more about trying to work out ways to get the largest audience and uptake possible without being exclusive to a particular group.
And certainly I'd add, you know, certainly in counselling, we work in a collaborative way. So by remaining curious, that is our inclusivity, because we learn so much from the clients that come to us. We're not there to, as Jeff said, have that power position where I know what's best for you. We work in collaboration with the people that we talk to.
Thank you. I've had another question come through. Again, I'd love to get all of your opinions and answers on this. And that's around working from home. And that's if people are now predominantly working from home, or, you know, that's their shift has changed to that. How do you either spot potentially problems, or what are people coming forward, you know, Jeff and Linda maybe in particular, people coming forward and saying that they have issues because of that? Or Catherine, have you heard that? Or how do you identify it if you can't see them like you used to be able to?
If I start certainly in the chats, procrastination is a huge issue. At home, it seems much easier to get distracted and to find just something else, and then so we talk quite a lot.
Yeah.
Anybody else want to comment on that?
I was going to say, from our side, it's a bit different, because of course by the time you're speaking to me, you've already done that first set of steps. So whether you're working from home or not, you've already addressed there's an issue. I think by the time you're seeing a doctor, you've already gained self-awareness that something's not right. Otherwise you wouldn't have made that call. You may not know what it is, but you know something's not right. And whether it's home working, face-to-face, whatever, I don't think it really alters the fact on how you might feel about something. It's just whether you have, like you said before, it's the approach of how you access the healthcare or the help that you need, really. Certainly I can't do any of my prostate checks on a home call. It's quite difficult, but we do find a lot of men are actually opting for video consultations now, and about half of our work is video based compared with face to face, because a lot of guys do feel far more comfortable in an environment that's their own, talking about something that may be very personal, as opposed to coming to a bit of a sterile office and then having to open up about something. So there are significant advantages of having that home environment to be able to open up and talk about things. Just not for prostate checks, obviously.
I think for us, the whole working from home piece, that's where we've needed a colleague-led approach more than any other way. It's been very much reliant on colleagues to check in on colleagues. We can't leave it down to the line managers. We've done work to train line managers and having conversations and starting conversations. But we then very much rely on these passionate advocates to continue those conversations. If you've got somebody on a Teams call and everyone's talking about their weekends and actually they're not opening up and not being forthcoming, but they usually are, actually we empower our colleagues and hopefully give them the knowledge and the confidence to seek out that person and say, well, what's going on, come and talk to us, or to signpost them to people like our mental health first aiders, who are then fully trained in all of the options that we have available. And over the past couple of years, we've launched 19 mental health first aiders into the business, and they're really our eyes and ears, and they are fully equipped to signpost to everything that we have available to our colleagues. So they're really valuable during that kind of work from home office hybrid space.
Thank you. And just to jump on some of those comments, I think the world has changed in terms of how people are engaging with things. Virtual can be more convenient, but I've certainly seen, from a Peppy perspective, men really like engaging with an anonymous chat because it's very easy to talk in a chat anonymously versus, I think, going back to the other end of the scale of potentially booking an appointment in person, attending an appointment in person, doing a follow-up in person. But those are still needed, of course, for things like Jeff said, physical examinations and other potentially parts of that process. I think we've got time for a couple more. I'm conscious of time again, but loads have come through, which is great. So thanks so much for the audience for engaging. Let me just pick one. There's quite a few. If there's any we haven't answered, we'll try and follow up separately for people. Actually, Catherine, you just mentioned about mental health first aiding. There's a question here that's come through. Do you see mental health first aiding positively impacting the workplace?
Yes. Simple answer, yes,
Right.
We do. Fantastic. It absolutely does. I think our mental health first aiders, I think within the first 6 months, I think 16% of our workforce had come forward to have a conversation with a mental health first aider. Now, that's a conversation that might not have happened if the mental health first aider was off, so it might have, but it might not have happened if it wasn't for the mental health first aid community. And the great thing about them is they're really open about their own experiences. So back to that storytelling that I keep going on about, they've done a huge amount of case studies and storytelling with our colleagues. So they've been really honest about their own experiences, which means that people coming forward feel like they can really trust them and already feel like they've kind of got something in common with them. And that's really, really helped. And the key thing with them is that they're not counsellors, they're not there to give advice, but what they are there to do is to give really clear signposting to all the things that we have available, because pick a mix solution is great, but actually it can be quite overwhelming if you're struggling. So what they're there to do is provide real clarity around the services and support that we can offer, just again to make the most of that time where somebody has been brave enough to come forward and to make sure that they seek out the right support.
Thank you. I'm a mental health first aider myself. I appreciate the program, but I think there are ways of delivering it incorrectly, in terms of it's not a tick box exercise. Just because you've done it once or it's in place doesn't mean that's it. And also, I think it's important to be really clear about what support people who have had that training can provide, and what other solutions are potentially available to support people, especially in crisis, or if they're looking for, certain diagnoses or things like that. You know, that's not what that is for. You know, and it's important to address getting potentially formal help in that space. And that's not to contradict what Jeff mentioned earlier around sometimes you don't have to get that. It's important, you know, to understand the moment as well, I think, and the context. Again, so I think it'd be great. I don't know if any of the panelists have any final comments they'd like to make on the topics we've discussed, as kind of a wrap up, you know, a final kind of epitaph type statement before we finish. Is there anything anyone wants to say?
I think for me, one of the things is that we also need to take the fear out of asking people, because although we're talking a lot about, you know, how to get men engaging, we're also responsible for not trying to engage with men at times because we think, oh, what if I say the wrong thing? You know, they seem really low. What if it's all my fault if it all goes wrong, or whatever? So there's something about addressing our own part in inviting, you know, men to talk about their mental health to us. Just to think about, you know, is it a fear when actually it's just another conversation.
Thank you.
I think my one would be is to never think it's done. You know, with a wellbeing strategy, don't tick the box and say that's done. We've got a wellbeing strategy where we're cracking on now. Track back, revisit what you've done, revisit the stories that you've told, ask for feedback from your colleagues, and just continue to evolve, you know, as the needs of your colleagues continue to change. I think that's the key one for us, is that we just keep on learning, keep on evolving, and keep on supporting our colleagues in the best way possible.
Yeah, it's probably better than anything I would have said. So generally, my biggest one is I'm not putting on an epitaph because I think that's just really morbid, but generally just this kind of just don't accept normal, don't accept being told that how you are is okay and that it's what it's supposed to be. And I cannot think of the number of people that we've ended up seeing put off speaking to somebody, seeing a doctor, speaking to counsellor, engaging with HR. Some they could have done months or years ago if they'd had that impetus to think, actually, maybe how I'm feeling isn't the way it's supposed to be. Maybe I should have had a blood test. Maybe I should have spoken to somebody. And you can save yourself years of feeling crap by doing something early about it. It makes the world of difference.
Thank you so much, and thank you all of you for an amazing chat over the past hour. It's flown by, and several moments I've completely forgot I'm supposed to be asking questions and, you know, being a host here, because all of the things you've been saying have been so engaging and really useful from an practical advice point. Honestly, Jeff, amazing. I just want to say, obviously, if anyone wants to learn more about Peppy, please get in touch, reach out to us. We're an app which, you know, facilitates one-to-one support for users. It engages people in their health and it gets them forward to treatment a lot quicker than not having it. So, you know, please do reach out and contact us. Thank you, Linda. Thank you, Catherine. Thank you, Jeff, ever so much for all your comments and engagement. It's been great. Thank you for everyone who's dialed in and all the brilliant questions we've had. And we'll follow up for any we've missed. And also, you know, thank you so much to our friends at This Can Happen for arranging this session and supporting us in getting together to talk about, you know, big topic events like this.
Thanks, Jack.
Thanks, everybody.
Thanks very much.
Goodbye.